from my own experience in the oncology field that non-small cell lung cancer and the number of biomarkers is increased. I think when I started, it was EGFR and ALK had just come onto the onto the stage, so it's quite a few now.
That's
Um,
right.
I think probably a question you get all the time is when does a doctor do biomarker testing, especially in an early stage uh, lung cancer, and what happens if your doctor doesn't bring up biomarker testing at an early stage? Should you be asking about it?
Yes, for patients with lung cancer, when you're initially given the diagnosis of lung cancer, that is a critical time point for doing biomarker testing. For many, many years already, national guidelines, including the NCCN guidelines, which is what the oncologists refer to for kind of standard of care therapy and diagnosis a routine, these guidelines have recommended biomarker testing for every single patient newly diagnosed with advanced stage or metastatic non-small cell lung cancer. So that's kind of old news. And
Mhm.
then more recently, biomarker testing is also recommended and part of routine care for patients diagnosed with earlier stage non-metastatic lung cancer, meaning that includes patients with stage 1 to stage 3 lung cancer. And the reason that these guidelines have been expanded for biomarker testing is that we've learned that these results do impact post-operative care or perioperative care, and also for patients that received chemoradiation for stage 3 lung cancer. But there have been studies done in the recent years looking at, so biomarker testing is recommended for patients with lung cancer. How successful are we in actually doing the biomarker testing? And the results and the statistics have been really sobering. There are many patients to date, even those patients with metastatic lung cancer, who don't get the right panel of biomarker testing performed. In some studies, it'll say the rate is as low as 50% or lower, 50% or lower frequency of patients getting the testing that they need in terms of biomarkers. And so all that is to really emphasize that it's important to be aware of the recommendation for biomarker testing in lung cancer and to make sure it is done. And absolutely, I would say patients should bring it up and ask about biomarker testing with their doctors. You should feel empowered to do this. There may be a reason, one reason or another, that they don't talk about it or that it's not done. But if you don't ask about it, you will not understand why, right? So if there was a specific reason that a particular biomarker testing was not done or that you haven't been informed about it, you want to understand why. So I would absolutely encourage that you talk to your doctors about it.
Yeah, that is a shocking statistic that you just gave us. And you mentioned there may be some reasons why. What types of reasons would a would the physician not recommend or not bring up biomarker testing?
I think the guidelines are evolving so fast in lung cancer, both in
Mhm.
terms of new therapies that are available and also in terms of the panel of biomarkers to test, that sometimes there is a delay in the adoption of the new guidelines, especially out in the community. For example, as
Right.
you said, Neil, for many years we've known that EGFR and ALK are actionable gene alterations in lung cancer where we can match to targeted therapies. And so I would say EGFR and ALK are more commonly tested for than some of the newer targets that have been identified, like MET exon 14 skipping or HER2 mutations or KRAS mutations even. And so the rate of testing for a specific biomarker is variable depending on how much is known about the biomarker. But a lot of it also has to do with the practical challenges of biomarker testing. Just as one example, not every patient has a tumor that is easily accessible and safe for biopsy. So some patients may have lots of small lung nodules where it's not at a size that's big enough for biopsy, or some patients may present with a lot of cancer burden, but they may all be concentrated in the brain, for example, and brain biopsy is super invasive and it's not always doable. Other times, a biopsy is successfully performed and we have the diagnosis of lung cancer, but there is just not enough tissue left over to do all the biomarker testing, like gene sequencing, for example. And so you run out of tissue that's necessary to do the biomarker testing. And to arrange a repeat biopsy and wait for the results to come back can often take weeks, and that just may not be affordable, and that may lead to hesitation in making sure all the biomarker testing is done. These are some of the more common reasons that I come across when I'm seeing second opinions of patients and not all biomarker testing have been done. These are the reasons that I'm seeing most commonly.
I see. That makes sense. Are there liquid biopsies available that can help, or are there any in development?
This is a highly relevant question these days. So yes, absolutely. Liquid biopsy is becoming increasingly used in lung cancer and throughout other cancer types also. Liquid biopsy refers to using a liquid sample, most commonly blood sample, to do the biomarker testing. And so in patients with lung cancer, we often use blood biopsies to look for particular mutations or gene changes. And often liquid biopsies can be quite helpful. So for example, in patients where tumor biopsy is not easily doable or safe, blood biopsies, I have had those patients for whom liquid biopsies ended up giving me the information I need. That said, I think of liquid biopsy as very much complementary to tumor biopsy. And so liquid biopsies are incredibly helpful when they come back revealing a gene driver, but sometimes they come back blank, as in they don't come back showing any gene changes. And there are two possible scenarios to explain that, right? One, that there truly is no targetable gene alteration in the patient's lung cancer. But the second possibility is that there just wasn't enough cancer DNA shed into the bloodstream. And so it was what we call a non-diagnostic test, meaning that when the liquid biopsy picks up a gene alteration, that tends to be highly reliable. But if it doesn't pick up anything, then we're back to square one, and we have to then really consider doing a tumor biopsy to make sure that a truly diagnostic biomarker testing was indeed performed.
Okay. And do many patients just simply have no identifiable mutation, driver mutation?
There is a fair subset of patients for whom there's no targetable driver. That said, if you look at patients, for example, who've had no smoking history or who've minimally smoked before, a significant proportion of those patients, well over half of those patients, will have a targetable gene alteration. And so my practice is to say, if you've had a liquid biopsy and it came back blank, to definitely try and do a repeat tumor biopsy if that's safe.